Good evening, all. I am Ganesh Rajan. I claim to be a recovered schizophrenia patient. I use the word recovered because I have coped, thanks to medicines and the management of symptoms. Currently, I mediate the English support group of Eklavya, and I'm on the Lived Experience Advisory Panel of Schizophrenia Research Foundation in Chennai. It's my privilege and honor to introduce our guest speaker for this evening, Dr. Ravi Samuel. Dr. Ravi Samuel is a qualified psychotherapist with multiple academic achievements, with a doctorate in medical and psychiatric social work from Madras University, Chennai. Dr. Samuel has nearly 2 decades of experience, including a stint in the UK, working with people having emotional, behavioral, and psychiatric issues. Currently on the academic roster and the board of many organizations, Dr. Samuel is also a trained practitioner of cognitive behavior therapy. Raviji has published multiple articles, papers, and authoritative books and has been on several television programs. He is based out of Chennai, India. The Eklavya family and our participants wish you a warm welcome. Over to you, sir. You're on mute, sir.
Thank you very much, Mr. Ganesh and Rajan. I really jumped at his invitation to speak on emotions of caregivers and patients because in our clinical experience, we find emotional reactions of caregivers producing various sorts of problems. Sometimes it even leads to depression in patients. Sometimes it triggers negative symptoms in schizophrenia. Sometimes it triggers a manic episode or a depressive episode. I strongly feel the emotions of caregivers and the patient interactions are very ignored area. I'm so surprised that Eklavya through Mr. Ganesh has initiated this, and I'm very happy that all of you have come here amidst your busy schedule at late evening to know about this. So I'm very thankful to all of you for coming, joining here, so that we can put our minds together and see how we can make a change, how we can make a difference in the lives of people. Right. Now, the entire process is oriented towards how do we reduce the conflicts between patients and caregivers. I'm sure all of you know that when a person becomes ill, particularly when they have a psychiatric problem or even a psychological problem, it's a very difficult journey for the entire family. Psychiatric illness do not affect an individual in isolation. It affects the family, the workplace, the community in which they live, the neighbors. Everybody has a part in it. Either they contribute to the recovery or worsen it. With all good intentions, they may worsen it. That is the tricky part of this whole exercise. That's what we are going to see. A person with all good intentions may talk something very, very uncalled for and trigger an intense depressive episode. If someone is depressed or even having a psychological problem, they become hypersensitive, and just a passing comment is all that is required to trigger a negative episode in them. So it's very, very important to be mindful of this. Today, what I'm hoping to achieve is making all of you aware of this process so that you can be mindful and probably advise others accordingly. To start with, any individual, be it a just born child or a 70-year-old man, there is an expectation by the family. The 70-year-old man is expected to take care of himself, take his medicines, eat, sleep on his own, with as less dependence on others. A child is expected to reach its milestones. If not, the parents get worried. So, expectation is a major factor. When someone has a major psychiatric problem, they cannot pursue active career. Sometimes, if they are not treated properly, they may not be able to even finish their academics. So, the caregivers have very high or even normal expectations that could be very high considering the patient's condition. If someone comes and tells you, I wake up very early in the morning, and you ask him, at what time do you wake up? He says, 3 o'clock. Then you raise your eyebrows. When he says, I wake up in the morning, you smile. You feel that's a nice thing. But if someone waking up by 3 o'clock, what does he do after that? It's a big question. So the context matters a lot. Everything is understood in the context, but a person with psychiatric problem may not see the context of what you're saying, so that can trigger a volcanic reaction, which will be very sad for the patient and for the caregivers. The second is the duration of the illness. When family comes for treatment, the first thing they want to know is, do we need to give medicines? And if the doctor says yes, you have to, then they know it is something serious. Then they want to know, how long should I give medicines and when can we stop the medicines? Interestingly, even when a psychiatrist's son or daughter has a problem, they ask the same question to us: when can we stop the medication? I'm at a loss when the psychiatrist who prescribes the medicines for hundreds of people is asking the question when it comes to his child. That is the expectation that caregivers have. And what is the nature of the illness? The nature of the illness sometimes affects the mood. The patient is completely dysfunctional, psychologically disabled. They may have condition like ebulia where they may get a thought that I should get up and go and brush my teeth, but the action does not come. When caregivers tell them, they know, yes, I have to get up and go and have my bath, but the action does not happen. That leads to frustration. The patient does not have control over this. The caregivers can get emotionally worked up due to this nature of the illness. They may not understand that it is the brain that is refusing to activate the person to go and execute a very normal action which they have been doing all their lives. And fourth is, what is the coping capacity of the caregiver? Some caregivers have Himalayan patience. They have a personality which is very conducive for the patient to recover. Some people have a personality which is non conducive for patient's recovery. Imagine someone who is extremely volatile having to deal with someone who is depressed. It's a very bad combination. Imagine someone who is very placid having to deal with someone with mania, bipolar disorder. It's a very bad combination. Whereas if a placid person has to deal with depression, it's a beautiful combination. They both will get along famously well. There won't be major hazards. So the kind of personality and the coping capacity of the person matters a lot. And all of you must have heard of expressed emotions, EE. There are caregivers who are very warm, no matter what the symptoms are. If a person is 30 years, not going for work, has got obsessive symptoms, he cannot wear certain types of dresses so that he can go out, no problem. Be at home, lie down, sleep, take medicines. I will give you the food. Do not worry about anything. We will take care. Your brother will take care after us. Kind of warmth that they provide. The other is the positive regard for a person, no matter what he does or no matter what he does not do. That is very, very important for any human being. Sometimes people who are retired have must have felt this. The respect and the authority that they enjoy is no more the next day of their retirement. The positive regard for them goes away. But if a family can provide this positive regard, then that would be a fantastic scenario for the patient to recover, because we are making the respect very unconditional. Sometimes the caregivers are over involved with the patient. They are over involved in the life of the patient, so that can affect the mental health of the patient. On the other hand, there are caregivers who are very hostile. Even for a mild depression, they may become very hostile, very angry. They may they may enter into conflicts very frequently, narrating all the mistakes done by the patient. And also critical comments constantly when provided by family. You're not able to finish your education, you're not gone for work, you're not earning money, you're not supporting the family, you're not doing household work, you're not helping the family. Kind of constant critical comments can trigger comorbid illness like depression, or can even trigger a mania in these people. So the expressed emotions of caregivers are extremely vital for us, for all of us. Setting a goal and having a roadmap is a normal thing that we do, particularly when the year starts. We kind of realign lots of the issues and set a goal, and then we kind of clinically proceed in attaining the goal. But look at the person with a psychiatric problem. They start with lack of interest. They are not interested to live. Forget about going for a job or finishing their education or doing business. Absolutely no interest at all. Then their mind can be very logical. They may not know what to prioritize. They may experience physiological lethargy. Even if they want to do, they don't feel like doing. And their thoughts, emotions can be bizarre, and their mind will be very confused. So imagine the situation when someone has all these in their brain, as confused and as bizarre. How can they move forward? So if we set plans for them and expect them to move forward with medication, it's not going to help. In my opinion, in my clinical opinion, I feel emotions of others are as important as medication for a patient. As important. Now, look at the emotions of a patient. He constantly experiences irrational, inconsistent thoughts, and he has to match a world which is very logical, very rational, and trying to be consistent. The desire can be very unrealistic. There was a man who went to CM's house and said, I want to be the next CM. The cop there was very understanding. He said, first you go to your place, register yourself in some party, and start interacting with your party people. I was so touched by that cop's patience and in his wisdom in dealing with someone who was having a problem. The knowledge can be very muddled in these patients. Similarly, the actions may be bizarre. At one point, they may be angry, at another point, they may be very docile. They may not really understand what exactly they are doing and why they are doing. And the use of negative emotions in them, lack of confidence, low self esteem, negative view of self, negative view of others, negative view of future. Just imagine the mind of a person with these problems. So, what can we do about it? This is the most important part that I want to stress on. Now, the first thing is we need to be very mindful of what kind of emotions we demonstrate. Are we demonstrating acceptance but not accepting genuinely? Are we just namesake pretending to accept but not deep inside? Patients will be aware of that. We need to be process oriented. We cannot set goals and expect patient to reach that. We need to sometimes go as slow as 3 4 months for a patient to have some sign of recovery. So we cannot set goals like in 3 months he should be up, and in another 6 months he should be able to go for work. So such goalposts don't work with patients. Do not go for medical shopping. Windows. A lot of people go for window shopping. Some people go for medical shopping. They go psychiatrist after psychiatrist after psychiatrist. The trust factor in a psychiatrist is very important, more than the medication. And the psychiatrist does not have a magic pill. Sometimes they have to experiment with each patient, and some combination might work. So we have to give them that space and time to get that combination right. So just going hopping psychiatrists will only make things worse. The other thing is we should stop testing people. If someone has memory problem, every day someone goes and asks, what is today's date? Which month is this? Please don't do that, because you know they have a memory problem. What they need is cognitive rehabilitation, not memory testing every day, which will make them feel bad because they are not able to remember. They are aware of their problem. Some of them will have insight, particularly in cases like dementia. Then every day asking them will make them feel very bad. Never use sign languages, because in many instances patients get to see father communicating something with the mother through sign language, or to the even the doctor. So that can really upset the patient, because they will not take it in a positive stride. They will take it very negatively. Even if someone does that to you, you won't take it very positively. So please be mindful of that. Do not talk about the person at all to your neighbors, to your friends, to your relatives, even to your spouse, because somehow if they get to know it, it causes a lot of damage. And others sometimes out of goodwill may carry that message to the patient, and the patient will sense that you have said something, that's why this person is coming and talking to me. The last one is positive statements are very, very important. At all times, keep making very positive statements, because they will be leading a life of lack of interest, confusion, no logic in their thinking. These are understanding of reality. Positive statements and encouraging statements can do wonders. It's very, very important to keep giving hope to the patient, because with the right kind of medication, psychotherapy, family atmosphere, they can overcome quite a few illnesses. At least they can minimize the symptoms and get back, bounce back to near normal functioning. There are lots of patients who are functioning extremely well. There used to be a girl who, the family of about four people used to bring them to my clinic. Today she is living abroad alone and working for Apple. So there are people who are working for Wipro, for TCS. They even go abroad and live alone. So they have become extremely functional from a very dysfunctional state. So, and also I should state, some of these companies are extremely sensitive to these people, and they give them lots of allowances. And the trend about 20 years ago was to avoid such people. Even in a place like America, they will not give employment if they come to know someone has got depression. But now times have changed. They are helping them to hold high positions thanks to this change. Now, all of us know that some of the problems faced by the patients are that family does not understand my physical symptoms. A lady comes to me, she has chest pain, non cardiac chest pain, what we call as NCCP, non cardiac chest pain, because quite a few times she has gone into medical emergency. They have done ECG and other required cardiac workup and found that she was absolutely normal. And at one point, the physician declared her as NCCP patient. But the family does not acknowledge that she has a problem. If someone has got such symptoms, it's difficult for the family to understand. But what we require here is the empathy. You may not understand everything unless you're a expert in all the subjects. Even if you're a psychotherapist, you may not understand certain symptoms if your wife is experiencing it or your husband is experiencing. Empathy is very important. What is empathy? Empathy is trying to understand from the shoes of the other person what they may be going through. Unless you have similar experience, you cannot understand what someone is going through. Can any of us understand the victims of war zone, war torn areas? People who have lost their partners, lost their child, lost their house, sitting in a refugee camp. We cannot empathize with them because we don't know what that is. We are only seeing it in television. We are not even seeing it live. So empathizing is difficult. So understanding is very, very important on their level. Not necessary that we have to apply our frame of mind to understand. We have to sometimes accept what the person is going through. Confronting. Sometimes, when a patient is experiencing a symptom like suspicion, as we see in paranoia, paranoid schizophrenia, or sometimes even in depression, confronting them with facts can worsen the situation. And a person with good intention may think, if I produce the facts, then he may change his mind, he may change his delusional thinking. No, that's not the way the mind works in a psychiatric condition. So confronting can worsen. If someone has got a delusional disorder and if you confront them, they can even become violent. Sometimes even in a phobic situation. If a lady is phobic towards a cockroach, and in a behavioral therapy a person suddenly showed her a picture of cockroach, and the lady slapped the therapist because she was completely not prepared for that. She was overwhelmed. She slapped the therapist. The therapist felt very bad. The patient felt very bad for slapping. The rapport was lost. She had to go to another therapist. Confronting, or sometimes, as we technically call it, flooding a patient, has to be done very carefully through specific process. Sometimes the logic does not apply. World is not a place full of logic. Emotions don't see logic. I'm sure all of you will agree with that. Logic has absolutely no place in emotions, much worse if we are a patient. Applying logic in an emotion. I once treated a lady for depression. Why she was depressed? The dog in her house died. Was she very attached to the dog? No. She actually dragged the dog out of the house during Diwali because of firecrackers. The dog used to come running inside. She dragged the dog out of the house and threw it outside. Again, it came inside. Again, she dragged the dog out. Following which, the dog refused to come inside the house. The dog got sick. It refused to come inside the house. It died. The patient developed severe depression. You, logically speaking, it does not add up. Someone who hates dog, how can she become depressed when the dog dies? That's not the way the mind works. Presumptions are a major problem for the patients. You have been on therapy for 6 months, you have been taking medicines, you should be all right now. Maybe you don't have the willpower, maybe you don't have the will to get up and do things. It's a presumption. The world does not operate based on logic. Sometimes it's much more than that. What we cannot see, we cannot simply rule out. Arguing with a patient is definitely a no, because arguments can intensely provoke emotions to the extent the patient may become violent. Continuous arguments may keep a very docile person in a very violent state to the extent of assaulting. So, when patients experience something, the caregivers, when they are not able to understand, that becomes the moment of conflict. So, if they are careful, if they are little judicious, then they can deal with the situation. Can I control my emotions? Many people think they cannot control their emotions. I think it is a very easy process to control emotions, but after having gone through a difficult process. What is a difficult process? Just retraining the brain. See, our brain is absolutely retrainable. I'm sure All of you must have heard about plasticity of the brain, the ability of the brain to readapt itself. The emotions are controlled by different areas in the brain, the thalamus, the amygdala. Given any situation, the first one to be triggered is the emotions, followed by the intellect very, very slowly. So, what happens? The patient gets angry, throws something like a phone. Forget about patient, even normal people throw a phone. Then the emotion is at full blast. Then slowly the intellect comes and says, actually, they didn't say that much offensive thing. Why did you get so angry? Why did you break a 20,000 rupees phone? Now fixing this is going to take another 10,000. Slowly the reasoning comes out and the person feels guilty. The person feels very bad for their action. Yesterday, I saw a patient from Canada who was upset and guilty for throwing a remote at his mother when he was 20 years. Now he is 45 years. So, 25 years of extreme guilt for an act done just off the moment. So, we have to understand this process that the intellect is very slow. The emotion is supersonic. It travels at Mach 3 or Mach 4 speed, while the intellect kind of moves at 4 kmph. So, emotions are time bound. If you're very angry, just be calm for about 45 minutes. The challenge is being calm for 45 minutes because you will have racing thoughts. How did they say this? How can they treat me like this? How can this happen? Now I have to give them back. I have to go and fight. I have to be assertive. I need to establish myself. All those fuel the fire. And most often we find that more than what the situation provoked, the patient works himself up. The person works himself up and gets more angry within a span of 30 seconds or 1 minute. Then the volcanic reaction happens. All you need to do is take your mind off completely from what disturbed you and listen to a music that you enjoy, or watch some comedy on your mobile, or read some pleasant messages. Then slowly you find that your anger is not there anymore. You are able to visualize the world in a very rational form. Now, just take a moment and think of 2003 events, all the good events. You will recollect those that has emotions attached to it. You will not recollect events that has no emotions at all. You must have experienced something very strongly. Those are the emotions that comes first. And unfortunately, the negative emotions come first. That's why we find people constantly brooding, constantly in an unhappy state, constantly irritable because they have negative emotional memories often coming to their mind. Yesterday, I posted in Facebook that memories should have an expiry date. Thoughts should have an expiry date. Emotions should have an expiry date because you cannot sit and brood about a love failure you had in school when you're in your 50s or 60s. It has to have some end point and we need to move on in life. So emotions have long term effect. People will remember what you said very less. but they will remember what you made them feel very strongly even after 20, 30 years. So be mindful of what you're saying and how you're making the other person feel, because that's what they are going to remember. That's what is going to predominantly influence their mind towards their reactions. Similarly, I'm sure all of you know about defense. There are some personalities who, if you tell them, please do not do this activity, then their mind immediately locks onto it and tries to do it. That's defense. If you don't tell them anything, they would not have done that at all. But the moment you tell them, don't do this, their mind wants to do it. That is what we call as defense. And it can also be in a severe condition among children, what we call as oppositional defiance disorder. The moment you tell them don't eat this, the child wants to eat. If you tell them sit and study, the child will not study. If you tell the child to eat and then sleep, the child will first go and sleep. So they will do exactly the opposite of what you're saying. Recollection of moments are always emotional, whether it is for you or for others. So be mindful of what kind of emotional experience you gave others. The book by Daniel Coleman, Emotional Intelligence, brought to the fore the importance of emotions, and everybody was reading those books. So thankfully, I think that created a lot of awareness, but still we have a long way to go. Emotions are difficult to train but easy to master. How is that possible? Well, if you practice even a difficult process repeatedly, you will move inch by inch and make progress. For example, I was telling you about how to control one's anger. If you try to go sit elsewhere, listen to music, it will be impossible because your mind will bounce you with thoughts. Then after a few days, you will find that you're able to listen to music, maybe with less attention, but with practice, more and more attention. And this is an interesting moment to tell you. We avoid people who give us negative emotional experience and approach people who give positive experiences. So if you want to retrain your brain, you approach people who are giving you negative experiences. It could be a friend who is constantly pulling your leg and irritating you, or it could be your spouse who is recollecting all your failures, or it could be some relative who talks completely illogical things and it winds you up. Those are the people with whom you need to go and spend time to practice this process, which will bring about beautiful changes. And the moment of victory is when you're in a situation which used to provoke you and you're not provoked. That is the moment you find that you have complete mastery over your emotions and the control is in your hands. If you get angry, then you have given away the control to the other person. If someone knows that they can make you angry, then you become vulnerable and they can manipulate you. I know some of my friends who have this knack of irritating others with constant bullying. During my school time, they know exactly what to say to irritate the other person so that the other person will get extremely explosive, and we will not know what will happen the next moment, but it is fun for these chaps. But for us, it is a very life threatening moment, and we'll be so scared as to what might happen the next moment, whom they will attack, or whether they will do something for themselves. But for these fellows, it is fun to provoke others. So it's very important that you do not give the control to others, that you keep the control. If you need to keep the control, your emotions is the control. If you control your emotions, then you're in your control. If you don't control your emotions, then you're giving away the control. If I can provoke you easily, then I have the control over you. So it is difficult to train, but definitely possible to master your emotions. Right. So with this, I think I'd like to thank all of you for your attention and participation. I throw the forum open for discussion. I think it'll be nice if we discuss.
Uh, Thank you, Doctor, for this wonderful session. Anybody who has questions, please put it in the chat box so we can read it and Doctor can answer that.
Thank you, Mrs. Ranjani Murthy.
Yeah, I have a question. I hope it's not. As you were talking, there are times when a person seeks to be one up in a relationship. The equality of power, or the need for power in a relationship, sometimes is very uh, intrusive into harmony which can have in a relationship. So that really is my question. How do we handle this power struggle within a relationship?
Beautiful question. Anyone who is seeking power is someone who is feeling weak inside. So we need to go many layers down to see why they are feeling weak. It could be some personal issue, or it could be something to do with the other person. The need for domination comes out of a sense of oppression or a sense of weakness. So balancing that equation would call for deep soul searching conversations and enabling the person to do self appreciations and to fill out that vacuum in them. Otherwise it becomes a power struggle and can lead to severe conflicts between couples.
Thank you very much, Doctor.
There are a lot of questions. I think I'll go one by one, I suppose so. Negative symptoms of schizophrenia which lacks emotions. What is the solution? See, the emotional regulation can be affected by cognitive deficits, particularly in a condition like schizophrenia. They need cognitive retraining. Cognitive stimulation will eventually lead to better cognitive functioning, and that can trigger emotional experiences because, be it in the amygdala or hippocampus or in the frontal lobe, they need specific exercises to stimulate that part of the brain so that it starts becoming functional and it starts triggering emotions. Otherwise, they may not feel so. Mr. KY Prabhu, sir, do share the presentation to my email. Oh, sure. If you're willing, sir, slides are beautiful. I spent a lot of time to prepare, make these slides. I'm very happy to share with you. I think uh, I'll save your email ID. Yes, I will share it with you, sir. I'm very happy to share because if it will be useful for somebody, I'm so happy.
Dr. Ravi,
Yeah,
may I suggest that those who are willing to go through the slides, they can please contact Eklavya Foundation, and if you pass on the slides to us, we will forward to them.
Very good. That is a even better idea.
Yes,
Yes.
that will save your time and energy. Yes, yes,
Yeah, sure,
yes.
sure.
Thank you very
And
much.
and thanks for that appreciation, because a lot of time spent on these. Awesome presentation. Got a lot of awareness, insight to bear with the PMS problem. Thanks a lot, doctor. Thank you so much, Ganesh and Ramamurthy, madam. Mohini Savetkar, what are the ways to induce goal directed behavior in a person with schizophrenia? See, as I showed you the roadmap with illogical thing, bizarre thing, and all that, set very small short term goals, which is backed by lots of appreciations and positive reinforcement. Then you can slowly develop on that. Immediately, if you start scheduling their day, or even scheduling ADL, activities of daily living, it will become very unrealistic goals. So if you set something very very small, that's where cognitive rehabilitation is very helpful. Give them a small exercise, they perform, they are successful, they are very happy. Yes, because we can feel good about ourselves only based on some activity, some performance. We cannot just like that feel good unless we are having some hallucination or something. So very important to structure it. What are the ways? Right, I've answered that. Oh, Priyanka, I'm a schizophrenia patient, teacher by profession as well as caregiver. Okay, sister of mine, and she's still in rehabilitation center. How do we get monetary fund? I think there are some NGOs which are very, very helpful. I think you need to approach these NGOs and seek support or even admission there, in their rehabilitation centers, so that your expenses are manageable. Ramswamy, can emotions be reversed into mere thoughts and eventually flushed out? Oh, beautiful question. Emotions are different, thoughts are different. Emotions is more of a factor that you feel. Thoughts are completely different because it is into a very logical structure. The best way to reverse or to flush out an emotion is to have different interpretations and different perspective of that emotional experience. If you look at your childhood and say you were beaten up by the teacher and you feel traumatized by it, if you take a perspective of in what way it helped you, in what way it brought about a change in you, and trace out some goodness that came out of it, then your perspective of that negative event changes. So we need to do that kind of reinterpretation of negative event, because as a child you might have reacted in a particular manner. The same event as a young boy or as a youth or a teenager, you will react in a different way. As an adult, you will react in a different way. So sometimes psychodrama is very helpful, because you can see the change in the cognition when you react as an adult to a childhood event. So if you approach someone who practices all these, it will be very helpful for you to overcome your emotions. Mr. Ganesh and Rajan, how to get help without talking about the problem? That's a bit tricky, because an intelligent person will figure out what is making you talk in a particular sense. So, so if you want to do that, the best way would be to pick up alternate activities. For example, If a person is not going for work and you want to talk about it, you can talk to someone else about someone else having to go for work. So indirect conversation, not involving the person, can give deeper insights to the person because they will start listening because somewhere they can relate to the issue.
Thank you so much. That was good.
What about the emotions of the caregiver? How do we self care? Very, very important to. If you are a caregiver, you are a priority. If you're a caregiver of someone with a chronic ailment, then you are the VIP. You need to do your medical checkups. You need to have your respite me moments where you can go and do whatever you enjoy the most. It can be just going to the garden and sitting there, or it can be watching a movie, or it can be going to a theater, it can be reading a book, it can be going to a coffee shop. Whatever it is, those smaller moments of relaxation, respite is very, very important. And you need to do it consciously, and you need to have a circle who will be willing to help you to do this, because many a times the caregiving is foisted on one person, or sometimes not foisted. The one person takes care all the responsibility to do so. So you need not do that. You can kind of share your responsibility so that you are not overloaded. Others also need to feel responsible, they need to do. So in many houses this happens. So always do not take what you need not. I always, as a life coach, I advise my people, always in a corporate setup, perform 70% of what you are capable of. Don't show 100%, because 100% for 6 months you are a burnout person. 70% at least you can sustain. So very important that we don't burn ourselves out in the process of caregiving. Deepti Deshmukh, what are the training to give for trigger for the emotions in negative symptoms which lacks? See, it can be playing a movie which has certain emotional component in it, or it can be narrating an event which can trigger some kind of an emotion. See, sometimes the activity that you're doing may trigger the emotion, but you may not get to feel it. It may not translate itself into a facial expression or a verbal expression. But repeated exposure will lead to changes in facial expression. Then you will know, okay, that person seemed to be responding to me emotionally. So to trigger the emotions, I would suggest storytelling, movies, narrating family incidents, or sometimes narrating your own experience which was emotional, so that the other person will start mimicking your emotions. Sometimes they have to relearn the emotional processes. Okay, for this I can laugh, for this I need to feel quiet, because that is very essential in social engagement. If a person does not have appropriate emotional reactions, then it affects their social engagement, and that leads to a lot of ridicule and rejection by the people around, and that leads to an isolated condition. Once a person is isolated, be it someone with the relationship issues or psychiatric issues, then they start feeling very negative intensely. So very, very important to help them with this and not ignore in the larger interest of the person. Email ID, please. Anil Vartak. uh sure, madam. I'll give you my email ID. Priyanka Birthday. Please give email ID, sir. Sure, I am very happy to give. Or you can also contact Eklavya. They will be happy to give you.
Yeah, Dr. Ravi, what I mean that individuals in the audience can drop an email to us, and we can forward them your presentation, as well as the summary of the presentation will be ready, and once you approve it, that also will be available for individual reading.
Definitely. I'll quickly run through. I think we have few more 3 minutes. So kindly educate us as psychiatrists in the initial phase of practice. We tend to apply our psychiatric knowledge and use technical words when we are put into arguments in our family, especially between couples. Later, it turns into a big trauma for the spouse or a family member. Kindly psychoeducate us with your expertise to manage such things. I really appreciate the wordings. People do forget what you have done, but don't forget how you made them feel. Yes. See, see, the technical terms are absolutely scary. Sometimes we need to downplay them unless they are very specifically asking for a medical purpose. We Sometimes we use jargons which can scare the daylights out of them, even if it is a simple diagnosis. So it's very important to kind of downplay the problem and use as many lay words as possible. Ganesh and Ramamurthy, my son, who has been in job for some 11 years now, gives various reasons to quit the job. He is very reluctant. What could be the reason for this, and how can I help? Well, I think your son may be experiencing some kind of negative experiences there, or probably is bored of that place, or maybe something to do with the interpersonal relationship. Uh, Whatever it is, I think after 11 years, a change is a good, welcome thing. So probably you need to encourage him to find a job and then make the switch over. Right. I think we have just had time to answer these questions. I'm so sorry about not answering others. Um, and nevertheless, if you write to me, I promise I will write back to you. Thank you very much, and I really enjoyed the session. I hope it was useful to all of you. Thank you very much.
Thank you so much, sir. Have a nice day
Thank
from
you
all
so
of
much.
us.
Thank you.
Thank
Thank
you.
you.
Thank you
Thank
very
you,
much.
Dr. Samuel. That was a wonderful interaction. Thank you. Really appreciate your time and the words of wisdom you shared here today.
Most welcome, sir.
Very simple, insightful, and cordial presentation. Thank you, sir. And we
Most
will looking forward to have few more interactive sessions with you.
sure, sure, sir. Anytime you
I'm
call me.
Anil Vartak. I'm Anil
Yeah.
Vartak.
Anytime you send word through Mr. Ganesh Rajan, I'll be there for you. Thank you, sir.
Thank you very much.
Thank you.
You have a
Thank
great
you,
day,
sir.
great
Thank you,
break
sir,
here.
for
All the rest.